Welcome to the Dr. Kumar Discovery Podcast. My name is Dr. Ravi Kumar. And on today's episode, I'm sitting down with Dr. Todd Born, a naturopathic doctor and certified nutritional specialist who spent the last 16 years treating one of the most common and most over-medicated and most misunderstood conditions in modern pediatrics, ADHD. Now, when most of us hear ADHD, our minds go to one place: the hyperactive kid in the back of the classroom, the one bouncing off the walls, the one who can't sit still through dinner, the one who eventually gets handed a prescription for Ritalin or Adderall and either turns into a zombie or finally calms down enough to make it through a whole school day. And yet, the standard of care for kids under 6, according to the American Academy of Pediatrics themselves, is not medication. It's behavioral support, parental support, nutrition, sleep, and environment. Medication is supposed to be the last resort, not the first. And that is not what's happening in this country. Dr. Born has built his practice around the question of what else can we do? And his answer is a multi-layered protocol that starts with diet, includes targeted supplementation, and leans heavily on something that we go deep on in this episode: homeopathy. Now, there's real debate on the efficacy of homeopathic remedies. Some well-designed clinical trials show it performs no better than placebo. Other well-designed trials show it performs equivalent to standard medications, but without any of the side effects. And both can be true at the same time. What most people miss in this debate is that placebo itself is incredibly powerful. There's a whole entire field of research dedicated to trying to replicate placebo on demand because the effect is real and very efficacious. So my take is, and you'll hear me say this in the conversation, is that if something is low risk and works some or most of the time, why be skeptical to the point of dismissal? We should be curious and we should be rigorous, but we should not be so dogmatic in our rejection of the unexplainable that we deny our patients something that might actually work. So, by the end of this episode, you're going to understand what ADHD actually is and how it's diagnosed today, why the standard stimulant medications don't improve academic outcomes long-term, the role of artificial food dyes and additives in attention and behavior, how constitutional homeopathy stacks up against methylphenidate in a head-to-head, double-blinded controlled trial, and Dr. Born's actual protocol for getting these kids off these medications. He's reporting a 100% success rate in his pediatric patients, which is extraordinary in itself. So, one more thing before we dive in is a quick disclaimer. Both Dr. Born and I are healthcare practitioners, but we're not your doctors. This show is for informational purposes only. Everything you learn from my conversation with Dr. Born is meant to empower you. So take this knowledge, ask better questions, and work with your own doctor to build a more informed, healthier life. That's what I want for you. And just to be clear, this show is also separate from my role as assistant professor at UNC. All right, let's get into it. My name is Dr. Ravi Kumar. I'm a neurosurgeon in search of the causes of human illness and the solutions that help us heal and thrive. I want you to join me on a journey of discovery as I turn over every stone in search of the roots of disease and the mysteries of our resilience. The human body is a mysterious and miraculous machine with an amazing ability to self-heal. Let us question everything and discover our true potentials. Welcome to the Dr. Kumar Discovery. Okay, Dr. Born, thanks so much for coming on the show. I'm really excited to have you here today because we're talking about ADHD. And this is a problem that so many Americans are experiencing, not only parents, but their children. And this is something that you have a very unique experience with. So I was hoping you could start off by telling us what ADHD is, how it's diagnosed, and how common it actually is.
Sure. Thanks for inviting me. I appreciate it. I've had a lot of good conversations with you, offline. So I'm not a pediatrician by any means, but I do see a lot of ADHD and other conduct disorders and whatnot. So the DSM-5 criteria changed from the DSM-4. There is no more ADD, ADHD. Now it's ADHD, either predominantly inattentive type, right? You can't pay attention, predominantly hyperactive, you can't sit still, you're kind of bouncing off the walls. The mixed type, which is what most people end up having. And that's what I end up seeing a lot in practice is kind of the mixed type of it. And it's really a diagnosis of exclusion, but in the DSM-5, which tells you basically the outline of all the criteria that the person needs to meet, and it does need to be diagnosed before the age of 13, and then you can have adult onset ADHD. It also has to appear the symptoms and how it manifests, whatever's happening and occurring in the individual, has to be seen in two separate environments. And this
Okay.
is a kind of a quandary that sometimes parents will bring their child to me is that they exhibit a bunch of these symptoms at home, but they're fine at school, or
Mm,
vice versa. So then it's difficult because they're like, well, I don't really meet this criteria or that criteria. And now I can't nowadays, right? You can get these IEPs with schools, these individualized educational protocols, which can modify. But if unless you carry the official diagnosis, the school can't do much really about it.
yeah. Okay. So how many kids out there actually have ADHD? Is it pretty common? Can you put a number on it?
There are some good statistics, and right when we look at these epidemiological statistics, right, these are people who are actually getting formally diagnosed. They go into centralized database, so there's certainly a few million people out there. There's probably 5 to 10 times more of that people who aren't getting diagnosed. Or what will sometimes happen is I've actually had parents come to me. They will specifically request that I do not use that ICD-10 diagnosis. And then I honor their wishes, and I was like, "It's just a
Yeah.
label, it's a number." And because it can go into insurance databases and you could see all these other, things that can happen. So, there's certainly millions of people that have it, and I would say that as you and I were talking earlier, our environment or the epigenetics of everything is certainly playing into this, and statistics bear this out that the average attention span, right, in the industrialized world just since social media has taken off has gone down a few seconds. So the average person, but not even a child, the average adult can only really pay attention for something for an abysmal 8.4 seconds, which is not very long, right? Before we're looking into something. So we kind of are fostering this universe and feeding into the inability to pay attention and causing anxiety and restlessness, especially in the United States, right? It's a very go, go, go society.
Yeah.
We don't, take a whole lot of time for to relaxation and everybody's on their phone and bombarded by social media. So yeah, high prevalence, and I see it more and more, and that's why I think there's more and more medications coming out to help
Yeah.
address the
Mhm.
disease, the condition.
Right. So when we think about ADHD, especially in children, we think about this, like you mentioned, this inability to concentrate and this hyperactivity, just bouncing off the walls, right? But you had mentioned that there's some other characteristics or maybe comorbidities that go along with it. And I guess I'm wondering, does sometimes this ADHD get missed and, parents just think, hey, my kid's depressed or my kid's super oppositional and defiant when it's actually maybe sourced or rooted in ADHD?
Yep, that's a good point to bring up because then I think that's missed by clinicians most of the time or neglected because they may only be exhibiting, you know, bouncing off the walls. So, I mean, in at least 30% of cases, and these aren't me pulling up random statistics, studies show this, that there is at least one comorbidity in an individual in an adolescent or a child who has ADHD. And
Okay.
it is sometimes difficult when a child can't explain, anxiety or depression. So you have to try to tease that out. And behavioralists and pediatric psychiatrists and psychologists are really good at this, draw this. But for the most part, it's just quick to go see your pediatrician. My kid doesn't sit still. They're going to get ready to get kicked out of school, or they're really mouthy. You need to do something. So what are you going to do? Typically, even though the standard of care from the American Academy of Pediatrics is no medications unless an absolute resort under the age of 6, then it's just here's, let's try this medication, where
Right.
a lot of times that medication makes the other things worse. So say you have ADHD and you're put on a stimulant, but you also have anxiety, that's just gonna make the individual more anxious, right? Because you just gave them a bunch of pharmaceutical speed. So,
Yeah.
yeah, now they're sitting still, but their anxiety is worse, and maybe now it's, like, more like that inner coil, or they're more aggressive now because they have, yeah, conduct disorder or something. So a lot of times
Yeah.
it does overlap, and it's almost always not even addressed. They don't send them to the behavioralist or the therapist. It's just, oh, let's do this med. And now, oh, is rearing its ugly head. Now we might need to give them, say, an SSRI or an
Yeah.
anxiolytic. And now you got an 8-year-old on polypharmacy. Now, I'm not anti-medication. There's a time and place for everything. But in my experience, you rarely need any medications in individuals have, ADHD and some of these comorbidities. They're not necessary.
Yeah. I read a statistic the other day. It was like two-thirds of kids between 4 and 5 who have this inattention or hyperactivity are prescribed, methylphenidate or some other
Right.
ADHD medication. And that scared me, honestly, because the young mind it's developing, it's making its connections, the connections that will be solidified and for the rest of their life, I mean, once you become an adult, things don't change like they do when you're a kid. And so the fact that so many children are having these medications circulating through their blood that affect their brains in ways that we don't really understand was kind of frightening to me. And I'm wondering, like, what do these medications do to these kids? And
Mhm.
I know they can be helpful because I hear parents say they're helpful, but is it sustainable? And is it having long-term effects on their brain development?
Sure. Those are good points you bring up because, again, back to the American Academy of Pediatrics, the position statement is you should be doing lifestyle modifications, home behavioral modifications, parental behavioral modifications. Like everything should be utilized before going to a medication. And sadly, what is our society? The way I kind of look at it, yeah, when you have a 3 or 4-year-old, they should be pretty high energy, right? They're a child. They
Yeah.
should be out there running around and playing. We are not, as humans, we are not designed, particularly at that age when creativity is explosive and that really neuroplastic brain, right? The frontal lobe hasn't really fully developed. They don't have higher cognitive thought. It's more instinctual thought. And they're supposed to run around. They're supposed to play. They're supposed to explore.
Yeah.
But yet we're mandated, and you look at other countries that are, say, ahead of us, like Western Europe and the UK and Japan. No, they're more Montessori and Waldorf style. Learn, explore, play, lifestyle skills, not just sit and be spoken to for 8 hours. Humans are not well designed, especially now we have
Mhm.
an 8-second attention span, right? We're not equipped and designed and not evolved to be just sat and spoken to all day. And that's a sad thing. And certainly these medications, one, I don't think they're warranted in most cases, right, for someone who's a 3, 4, and 5-year-old, when all these other interventions can happen, and there's a lot of side effects to them, which is why people end up seeing me a lot in children. Their parents bring them to me because, right, you can get agitation, you can get insomnia, anorexia, their appetite suppressants, so then now your child's falling off the growth charts, behavioral issues, and most parents are like, "My child's a total zombie," and even the child themselves are like, "I don't like how I feel on these medications."
Yeah.
But the school mandated it, or maybe the parents were just at their wits' end, right? Because this child's just a bit of a tyrant and not sleeping and destroying the place. But I'm a big fan of behavioralists, and I honestly don't think that they're used. And occupational therapists, I don't think they're used enough in these cases because they can really help
Yeah.
modify behavior and train that brain on how to control some of these emotions.
No, I mean, I was put on Ritalin when I was a kid, I mean, I was bouncing off the walls like normal kids do. Maybe I was bouncing off the walls more than the other ones, but the
Mhm.
teacher basically went to my mom, and I think I was in kindergarten or first grade, and said, "If you don't put him on medication, we're not gonna teach him." And so they put
Yeah.
me on Ritalin, and I became a zombie, and my mom hated it, and she took me off, and she, she's a bulldog parent, so she went to the school and said, "Don't ever tell me something like that again, and my kid's not gonna be on medication." And I came out fine, right? My cognitive potential was realized, but even though maybe I struggled in school early on, but yeah, I agree with you. There's this huge mismatch between what we were built to be and do and what we're expected to in this modern world. No person at any age, especially not a kid, should be sitting and being lectured to for 8 hours a day with,
Right.
a couple 20-minute recesses. That's just, it's unnatural. And I can see how that would drive this, a certain contingent of the child population to just not fit into the square shape that society's trying to push them into. And
Mhm.
so, honestly, I feel like medicating kids to be something that they're not can be a mistake. I'm like you, I'm not anti-medication at all. And in certain situations, it probably makes sense. But tell me what medications are being prescribed, how they work, and what kind of academic results or life results
Right.
will parents see if they put them on these standard medications that are prescribed?
Yeah. I mean, the first line medications, right, are going to be the stimulant medications, methylphenidate, things like Ritalin and Adderall are kind of the classic. And then there's some other class of drugs that the mechanism is not even fully elucidated. We don't really know why, or the researchers don't necessarily know why, like SSRIs, SNRIs. We may understand why those work with some combative disorders, contact oppositional defiance, anxiety, but how are they helping people focus? It's not well clear. Some kids, they'll actually be put on benzodiazepines along with the stimulant medications because one can calm them down, help them focus. But
Yeah.
then, their anxiety gets worse. So now they're kind of getting these GABA agonists, GABAergic medications. But if you actually look at the studies, and these are well conducted studies, that yes, attention increases, but learning actually does not increase. And they have no better test scores than if they were not on the medications over time. So in medicine, everything's a risk benefit ratio. It's like, and does it improve outcomes? Well, the risk is moderate. Benefits could be high that the person's to be able to sit and focus. But what about outcomes? There is no improvement in any outcomes when you put these individuals on these medications. Test scores don't
Mm.
improve, grades don't improve, but yet the laundry list of side effects is pretty high. So again, in my experience, and I don't blame my conventionally trained brethren because my colleagues, which most of my friends are MDs and DOs, and some are functional medicine, some are conventional. They don't have any options. Even my family
Mm.
practice doc with my 4 kids and my doctor, he himself, he's like, I get parents to me all the time come with ADHD. And he's like, all I know are meds. And I send him to behavioralists and occupational therapy. He's like, what do you have? What would you guys do as a naturopath? And I talked to him about everything. I sent him a link to when I've given presentations at medical conferences. He's like, I wish I had that to offer, but at least I can refer them for people who don't want. He's like,
Yeah.
otherwise, yeah, it's just straight up meds. It's just, that's all we do.
Yeah.
Just quick with the script pad. And he doesn't like it, but he's like, that's my only training.
Right. So if it doesn't improve academic performance in kids, then essentially all these medications are doing is basically placing a cognitive leash on the kids so the teachers can control them during the day and the parents can hopefully control them at home if they're having problems. And I wouldn't say that's something people shouldn't do, but that's, I think, the way that you should think about it. You're not making your kid cognitively better. You're just putting a medicated cage around them, essentially.
Yeah.
What about adults? Are these medications safer or better in adults? And should adults with ADHD be less worried about them?
That's a good segue because if you look at these kids, right, and then you give them the medications, part of the problems with the medications is high addiction potential and high tolerance. So you're really, and
Okay.
it's essentially a Band-Aid, right? They wear off, you take
Mhm.
more. And that's the problem is that you take the short acting in the morning or you take the long acting in the morning. And then by the afternoon, now you got to take another dose. And now you're getting insomnia because you got too much stimulants in your body. You're not really retraining while that brain is neuroplastic. You're not training your body and your brain to better control those behaviors. So what we tend to see into adulthood is that most of the comorbidities still exist, anxiety, depression. But now what we see more, and the studies bear this out, is because it's a high addiction and impulsivity, right? That's part of the criteria is you're highly impulsive and you tend to have high addiction potential. So it becomes a world of self-medication is that you have higher abuse of alcohol and illicit drugs to try to say
Mm.
have that same kind of dopamine effect. And part of that, I think, and I'm sure studies probably look at this and we could find those, is that not enough of that, therapy from a behavioral standpoint, occupational therapy, counseling was done early on. So you just basically, okay, I was all medicated through childhood. Now I'm an adult and I got to keep a job down. So I just went from this stimulant now I'm on, I went on Ritalin, then I was on Adderall, and now I'm on Strattera, and I also take, I'm on a benzo, and then I get a lot of palpitations, so I'm on a beta blocker. And you're 21 years old, and you've got 4 meds on board. So yeah, it's certainly, and because when you get older, right, your brain isn't as neuroplastic as adolescents, and those synapses. Well, I see adults with ADHD, and they're like, I want to be off all these meds, and I say, well, let's try, right? I'm always hopeful, but at the very least, we can usually get you down to one at a very low dose because your brain has already made those connections now in life, and it's
Yeah.
hard to undo those. it works just as well, but kids are so much more vital than adults. They respond quicker and say more curative. But I've still had plenty of adults either go on off all their meds and they're like, this is great. And I just take these supplements or whatever instead. Diet's a big portion. Or they're like, this is awesome. I just take 5 milligrams of like extended release methylphenidate. I can work my whole day, wears off. I go home. I don't feel all amped up or anxious and I can sleep now. My appetite's not suppressed. I'm eating better. So for all of us, I think that's a win, in my book.
Yeah. And everyone wants to hear about your protocols that are getting these amazing results. But before we get to that, I want to ask you one more thing, and that's about what is possibly causing this. Is it just that we are built a certain way and we're living in a different environment, or are there factors that are new in our environment that might be pushing us down this path of inattention and hyperactivity?
Right. As with anything, I think it's very multifactorial, right? And people say, well, we don't know the cause of ADHD. Well, there is no one single cause. We do know there's a whole slew of factors, right? Genetic propensity is very strong. It's one of the most highly inheritable conditions. So when someone comes to me and they bring their child, then I usually try to, play around a little bit and take light, but also be serious and say, okay, who has ADHD? Whose fault is it? And the mom will almost invariably, because it has a high male preponderance, but they'll always say, oh, my husband, their father. He can't sit still.
Mm.
He's bouncing off the walls. He does see that, so it is. And even in studies where they took homozygous twins, there's like a 98% probability that they both have ADHD. So
Mm.
genetics is certainly one. And that's what we see a lot in medicine, right? Genetics loads the gun, environment pulls the trigger. So certainly our
Yeah.
environment's a big piece. The way we live in our society is another big piece. I mean, I have 30% of my practice is international. And obviously it's a small window size, but I don't ever have people coming to me because that's what their complaints are is ADHD. And their school days are shorter. I have friends that now, they live in Germany because it's a better quality of life for the most
Yeah.
part. Their kids go to school for less time in a day, and yet they have way better test scores. I mean, America is falling way behind. If you look at our national science and math and reading, but yet we're in school like all the time.
Yeah.
So environment's a big thing, genetics is a big thing, it's societal that yeah, you got to sit. It's also I think the way we educate our children, our youth, right? To sit and be lectured to 8 hours a day is a very efficient means of disseminating information. It's a very inefficient means of learning anything, right?
Yeah.
That's why even homeschooling's more popular now, the Waldorf and Montessori systems where it's much more hands-on skills learning. I mean, you even as a neurosurgeon, you know this well, right? How much are you going to learn from a textbook? You have to be in there in the lab
Mm.
doing the real deal because that's how humans learn. We learn by doing. We don't learn by just sitting and being spoken to all
Yeah.
day.
Yeah. That's the
So
truth.
yeah.
Yeah. So, what about you had mentioned iron levels in children earlier? And I thought that was very interesting because most parents never think, oh, what's my child's iron status? But this is something that you've seen a pattern with, and it's been reported in the literature. Tell me about that.
But so, yeah, part of the multifactorial thing is I have hardly ever, it's rare that I've seen someone with ADHD, conduct disorder, oppositional defiant disorder, any of these kind of over autism spectrum that doesn't have some nutritional deficiency, usually more than one. And there's a couple causes of this, and that's probably why the literature bears it out, right? Is that if you also talk to a lot of these individuals, their diet is the SAD diet, right? The standard American diet. They're very limited. They're not eating a lot of fruits and vegetables. So it makes sense, right, that they're essentially malnourished. So when we look at the dietary aspect of it, and particularly with aggression and low IQ, iron is one of them. And so most physicians aren't going to think of, things like zinc and vitamin C and magnesium and iron to assess that nutritional status because all those are important, right? You need zinc and vitamin C to make neurotransmitters, particularly dopamine, right? The feel good one, as well as serotonin. So that's why studies for individuals who are put on SSRIs, and if you give them vitamin C and zinc, they have improved outcomes because you need those cofactors to make serotonin, protein, blood sugar. As adults, think about how you feel. Some people can marathon, right? They can sit and fast forever and they're fine. Most people are not like that, right? We feel hypoglycemic, brain fog, fatigue, irritability, can't think, can't concentrate. Well, imagine that in a child. Children don't know what's going on. they have larger swings because they haven't lived long enough to be able to manage these things. So, like, I'm really appreciative of my children's school, which is a public school here in Gig Harbor, but it's very Montessori-esque, very hands-on, lots of drinking water, lots of snack time. I mean, even in 5th grade, you're eating snacks. If they see a kid start to wig out and get all agitated, they will literally be like, "I think you should go and eat a snack." And they, they have healthy snacks in the classroom that are donated by the parents, and then their own lunch. So yeah, a lot of people, most conventional clinicians will think of thyroid, right, congenital hypothyroidism, because we know that leads to low IQ and low birth weight. Very few clinicians consider all these other nutritional components that are at play, like artificial, flavorings, preservatives, sweeteners, which is not a conspiracy theory. There's good studies to
Yeah.
show it.
Yeah, no, that's one thing I've noticed with my kids is this whenever they ate candy that had artificial colors, and it seemed to me like it was more associated with Red 40. I
Mhm.
mean, that's my observation. They would just wig out. And then, we did an experiment in our house. We were like, okay, first we took all candy away from them. That's just sad, to not let your kids have sugar when the other kids have sugar. And
Right.
I'm not we don't have a lot of sugar in our house, but we wanted to let them have those little simple joys. So we bought these candies that did not have artificial colors in them. They were
Nice.
just sugar and gelatin and whatever they put, all natural ingredients, and they wouldn't become hyperactive. I mean, literally, they could eat a whole boatload of candy and they'd be still just normal kids. But as soon as you put something that's completely artificial, synthesized in a chemistry laboratory from petroleum byproducts in these kids' bodies, they're lipophilic, they go into the brain, and you see
Mhm.
you see effects. And I know there's parents out there listening right now and saying, "Yeah, I've seen that too." And the scientific literature bears it out, and
Yep.
specifically with ADHD. And has that been your experience?
Yeah, definitely. So, I mean, I can't tell how many debates, if you will, I've had with conventional physicians over the years, family practice, and pediatricians are like, diet has nothing to do with an individual's ADHD. I was like, first of all, that makes no sense from just a common sense standpoint, right?
Yeah,
Which,
right.
garbage in, garbage out. Good stuff in, good out. Second is that also the research literature substantiates what you and I are talking about. One of my favorite studies is where they gave a bunch of people basically from like the ages of 8 through 14. And these were individuals who were diagnosed with ADHD and then individuals with no diagnosis of ADHD. And they either gave them this like artificially colored drink, it was probably like Mountain Dew or something, or a similar drink that looked exactly the same, tasted the same, but was naturally dyed, like a natural color. It was a blinded trial, so the individuals didn't know what they were consuming. And then they had a bunch of specialists in ADHD monitor them over time, over like a 24-hour period, and they had to take some subjective scores, nothing objective, except for what the individual, the specialist, objectifying. And it not only did the ADHD, which was expected, they got all their symptoms worsened. But then
Yeah.
even the individuals who did not carry the ADHD diagnosis nor any symptoms started exhibiting ADHD symptoms, aggression, and
Mhm.
inactive inattention. And they were giving them tests and they did worse versus baseline. So that's a great one just to show you that it's not just individuals who may be more susceptible, albeit their symptoms worsened because also, but their baseline was,
Yeah.
lower as far as how they reacted. But even individuals couldn't pay attention. So this whole nonsense that, oh, well, artificial dyes, colorings, sweeteners, additives don't play a negative role in anything is hogwash because the studies are pretty solid. And that's why many of these ingredients, they're banned in most industrialized countries, but the United States still allows them in the food supply. And like you said, and I get parents that will be like, oh, my child, they're eating such a restrictive diet. Because that's the first thing I say on the treatment plan after the visit is no artificial flavorings, colorings, preservatives, dyes. And they're like, well, I said, I'm not saying you can't, because diet's hard to change. I'm not saying you can't give them the ice
Mm.
cream or the cookie or, the lollipop. Just get one that doesn't have any artificial. I'll give them links to the
Yeah.
natural candy store. I mean, there's so many options now. That's the first thing that goes on the treatment plan too. And if they don't believe me, I'm like, you want me to send you like 6 or 8 studies? Do you really want to read them? That's cool. I'll do that.
Yeah, I'm totally with you on that. And I honestly, from a common sense standpoint, I don't understand why any regulator ever thought, yeah, take that petroleum distillate, take that chemical that's never been existed in nature before and put
Right.
it in food, make it part of the food supply. It just doesn't make sense. In fact, if they just put little labels on candy and said, "Hey, this has a petroleum-based chemically synthesized chemical in it," just want to let you know. Just,
Right.
if they put that on every candy label, no one would eat it, right? But it's like an undisclosed risk that we have. And you see all these kids out there, they're drinking, red Gatorade and Twizzlers or, Skittles or whatever. And the kids who don't have that feel like they're missing out on their childhood because they don't
Yeah.
have that.
Yeah.
But
Oh yeah.
I mean, you're right. There's good alternatives now. When we were kids, there weren't. Now there is, and
Yeah.
there's stuff that tastes good, and kids can get their little sugar fix that's not going to harm them, especially if they're metabolically healthy. And I
Yeah.
think you're right. Every parent would do themselves a favor by taking chemicals, artificial laboratory synthesized chemicals out of their kids' bodies, food
Yeah.
supply. Yeah,
Right, right. Yeah, I go to blows with my 11-year-old son all the time because he hates it that, if we give him chocolate or like a cookie in his lunch or what have you, he's always yelling at my wife and I. He's like, "You guys just give me the generics. You give me the knockoffs. That's an M&M knockoff." I said, Timmy, it's not, they're not knockoffs. They just don't have any of the artificial. They taste better. And he's like, no, they don't. And I think part of his psyche is like, yeah, maybe his classmates got a bag of M&Ms, like especially around
right.
Halloween, right? And he's
Yeah,
got, the no dye. They're called raindrops, right? They don't have an M on there. They have no. It's all flavored with natural color or natural
yeah.
flavorings, natural colors. Doesn't have any synthetics, anything. And he just gives us a hard time that we're just giving him generic knockoffs. And then I said, "Fine, you don't have to eat it at all." But yeah, he'll be like, Eat it anyway." He's 11.
Yeah, no, I have the same conversation with my kids. Hey guys, I need a quick favor. If you're getting value from this show, would you please take 30 seconds to rate and review us on Apple Podcasts? I know it seems like nothing, but it genuinely changes how many people the algorithm puts this show in front of. And if an episode hits home for you, send it to someone who you think needs to hear it. I'm doing this to cut through the noise and bring you clear, honest information on health topics that actually matter to all of us. So please help me get this show to more people who need it. Cheers. Okay, so tell us about omega-3 fatty acids, because this is something that most parents don't think about either. In fact, I don't think I ever took any omega-3 supplement, and we didn't eat a lot of seafood growing up. I
Right.
came out okay, but what role does that have in child's neurodevelopment, and maybe what role does it play in ADHD?
Right. And even most conventional physicians that's like the one thing that they will recommend. The problem is that they're not recommending high enough doses. And I see this all the time with patients. They're coming in. I'm like, what have you tried? What's worked? What's not worked? And they're like, oh, I give them this fish oil. And then, my pediatrician recommended it. It's a perfectly quality brand, but it's like 200 milligrams. They're not noticing any difference. So the mechanism isn't fully understood. One of the theories is that you have some neuroinflammation and,
Yeah.
these PUFAs, the polyunsaturated fatty acids, they are anti-inflammatory, but and what we noticed there was one study where they took individuals who had ADHD versus the control group, which was the same age cohort who did not have any, and they measured in blood serum PUFA levels, different omegas, essential fatty acid levels. And what they saw, and they had a couple hundred people, and this has been replicated by even different authors, the baseline values in individuals that have ADHD, whether it's probably diets or what have you, could be an absorption issue, could be an intercalation cell issue. It's probably all of it. They have much lower levels than their cohorts. So
Mhm.
one reason why these work so well is you got to get them back up to where people who don't have symptoms, and you got to give them enough. So what we see a lot of times in the natural medicine world is that things are either poor quality and or they're just underdosed. So what
Yeah.
I'll do is give a child, say, a really, really potent, high quality, molecularly distilled omega-3 fatty acid that's high DHA. And we're talking, not to me scary doses, but someone else might be like, oh my gosh, you just gave them 2,000 milligrams and a 6-year-old. I was like, yeah, but you got to give them those loading doses, get them back up, get their cells saturated and make those cells more fluid in the brain health, et cetera, since our brain is mostly fat. And
Yeah.
then you can start tapering down. And even anecdotally, right, seeing thousands of patients with ADHD over time, the parents will come back and be like, yeah, it is totally different. My child is calmer. They're less agitated. They're not throwing the controller after they die in their game and
Mhm.
Roblox or what have you. And then I'm like, okay, so now we're good. I don't like to poke kids unless I have to. I'm like, I don't need to do a blood draw because we can make inferences and it's very safe. I just say watch for easy bruising and bleeding. And
Mhm.
then you titrate up slowly, otherwise you get some gastric distress. And the erythropoietic system will kick in and start making more red blood cells anyway, platelets. But
Yeah.
yeah, you just kind of titrate up and then you can go down, dose by weight and also by the worse their symptoms are, the higher amount. But they seem to be working mostly on just this anti-inflammatory pathway with certain, cytokines and chemokines, as well as the fact they're making the cells more fluid so things go in and out easier.
Yeah. No, I think that's something that both adults and children get missed on their clinical exams because no one thinks about omega-3 fatty acids. And I know you
Right.
said a lot of doctors will prescribe them. I've never had a doctor prescribe me or my children an omega-3 fatty acid. In fact, no one's even ever mentioned it.
Yeah.
But, I've done a lot of research on this and I know how important it is. I mean, omega-3s for the audience, they're essential fatty acids. They're polyunsaturated fatty acids that are essential. Omega-6 fatty acids are also essential, and omega-6s are the pro-inflammatory polyunsaturated fats, and omega-3s are the anti-inflammatory. And you need both. You need to push and pull. You need to push on inflammation when you need it
Yeah.
and pull it back when you don't need it with omega-3s. And the brain is heavily invested in these polyunsaturated fatty acids. And if you have too much omega-6 fatty acid in your diet, which almost everybody does because it's
Mhm.
vegetable oil, seed oils. Those are almost 70% omega-6 polyunsaturated fatty acids. And you're not getting seafood or taking a supplement,
Yeah.
you're overloaded on omega-6 and deficient on omega-3s. And that sets up this cascade of potential neurological inflammation, whole body inflammation. And so I agree with you on that. Omega-3 fatty acids, they're essential to growing brains. And it
Yeah.
does not surprise me at all that kids with ADHD have lower baseline omega-3 fatty acids.
Right. I mean, how many Americans don't tend to eat a lot of seafood, sea vegetables? Then, what we've done to our world, right, is that, I mean, I live in the Pacific Northwest, right? I mean, that there's a few things they take very seriously here, one of which is seafood. But even the University of Washington did a bunch of studies of, deep sea fish in the Puget Sound as well as the Pacific Ocean. And they are showing, unacceptable, even above EPA limits of human hormones, and they postulate that that's because so many women are taking oral contraceptives, and so it's coming out in their urine, right? Where does urine go?
Right.
And then people are like, "What about the mercury?" And I said, "I get it, but there's so many other health benefits. So just, don't go high up the food chain, eat swordfish every day. Go lower on, go a little bit lower.
Yeah.
But yeah, use a high quality molecularly distilled fish oil. Now with the
Yeah.
world of gummies, lots of kids and companies make the gummies, but you get into that same aspect is that you can only fit so much into a gummy. It's mostly pectin and sugar and what have you, gelatin
Right.
or veggie gelatin. So if you look at the gummies, and I always say, bring in your bottle or show it to me, because my practice is now all telehealth and has been for quite a few years, that they'll show it to me. And then I said, see, you can eat 4 of those and you're only getting like 300 milligrams. So I need your child to eat 20 of those a day. And they're like, oh, it's like, yeah, exactly. So to get what we need into them. So that's where we go to the
Yeah.
liquids and you can hide them pretty easily in Concord grape juice and
Yeah.
pomegranate juice. I wouldn't put them in smoothies, right? Because then you got this whole thing. The children, the difficult thing is getting stuff into them because they got taste aversions. They can't swallow pills yet. But there's so many ways to do it. And I've had to get creative, but haven't had many issues with getting stuff into people.
Okay. Yeah. No, I give my kids a capsule because of those issues you mentioned with eating seafood, having high levels of, contaminants, because all our pollutants flow out to the ocean. Our oceans
Yeah.
are a sink for pollutants, and mercury as well. But if you get a fish oil supplement, make sure it's molecularly distilled, like Dr. Bourne just mentioned. And also, the other thing I look for is IFO certification, which is
That's right.
International Fish Oil Standards. It makes sure that the oil is not oxidized or rancid, which it
Yep.
can happen with fish oils because they're polyunsaturated. So if you
Yep.
follow those two and then get the right dosing, which, you're recommending dosing that's actually been done in clinical trials in kids, then I think it's totally safe and it's a more evolutionary match than just eating the standard American diet with no omega-3 fatty acids.
Yeah. All processed foods, fast food,
Yeah.
there's a reason that we have a healthcare crisis, right? And a lot of it is just, it is poor dietary choices.
Yeah. Okay, so let's talk about how you are treating kids and adults with ADHD. What they come to you, they're either on medications or they've been recommended to go on them. What are you going to
Right.
do with them?
So it doesn't matter whether they're on meds or trying to avoid the medications, or they actually had to stop the meds because they had too many side effects. Those are kind of the three big camps of what I'll end up
Okay.
seeing, whether they're a child or an adult. So I always go through like, okay, so what are your symptoms? What's going on? How's the behavior? What's worked, what's not worked. And then when I, especially assessing what's not worked, because a lot of times parents will, or even adults, oh, I tried astaxanthin, or I tried this, or I tried this, tincture, or this homeopathic. But again, it's just not either high quality or it's just not dosed in a high enough amount, right? I mean, natural agents don't, the disadvantage is they don't work like drugs. They're not as potent necessarily. The advantage is that they don't have necessarily the side effect profile as medications, and they tend to work multimodal, multi-mechanistic. So yeah,
Yeah.
we go through everything, and then I'm like, I'm definitely going to do a quick dietary recall, and it's pretty much unheard of if someone's diet, and that doesn't have to be stellar, but it needs to be reasonable, right? Oh yeah, my kid basically just eats a bunch of simple carbohydrates all day. Well, where's the protein? And where's the high quality protein besides McDonald's, which is not high
Yeah.
quality protein, right? We live in a society where we have a lot of caloric rich foods, but they're nutrient deplete, right? I mean, there's no
Mhm.
substantial, health benefits to a lot of what we eat, and people are going to. And I understand. I have 4 kids. I have a private practice. I do a lot of consulting. I don't know what it's like to be busy. Even like some of my kids and their soccer teammates, like they're always like they're going to McDonald's after the game. My kids like, why can't we go to McDonald's? Like we don't eat McDonald's. I keep picking on McDonald's, but you know where I'm going with this.
Yeah.
So I'm usually like, okay. Diet's always the first. So in naturopathic medicine, which is one of the few differences as far as ideology with conventional training, is that we have this thing called a therapeutic order. It's shaped like a pyramid where you're initiating the least invasive, least aggressive treatment interventions first, saving drugs and surgery as a last resort. So it's not anti-drugs and surgery, but you also meet the patient where they are, right? Someone comes in, they chop their arm off in a saw. That's not the time to start putting poultices on there. You need to go to the emergency room. So
Yeah.
with them, it's like, what are you eating? The first thing, is assessing that. And diet is difficult to change in anybody, a child or an adult. So I usually will add things in before I take away because that's a hard thing to do, except for the one thing I will take away is everybody. For number one thing on the treatment plan is no artificial flavorings, colorings, preservatives, or additives to any of your food. You want to eat the cookies, the ice cream, fine, we'll change that later. But right now, I need this because part of it is also you usually only have one or two opportunities right before they just go doctor shopping and they bounce out, and you are like, oh man, I wish, after 16 years of practice, I don't have attrition much anymore. But it sucks because you're like, I knew I could have helped that person. So keeping things reasonable. So I'll end up doing that. They usually come in on a whole bunch of supplements, you know, friends, neighbors, friends, a meta ad, an influencer with no medical training or health training is so they got all these things. They don't know what to give, what's working, what's not working. As long as they're quality brands, because they already spent the money, I'll actually give them appropriate dosing. And there's a big
Yeah.
aspect to the gut microbiome, which we know is time for another podcast, but 70% of our neurotransmitters are produced in the gut. So it makes sense that you're going to address that. And in children, things like dysbiosis aren't usually, which is an inordinate amount of bad critters in the small and large intestine versus healthy ones. But
Mhm.
that's fine. You could still give them good probiotics to modulate that, these psychobiotics that have a gut brain axis connection, those kind of things. So it's
Okay.
usually the way I structure my practice is the diet is the first, and then giving them what's called the constitutional homeopathic medicine, which are these little sugar pellets that are great because there's no side effects, there's no interactions, there's no contraindications. And then depending on how old they are and what's going on in their diet, we do talk about blood tests, and I do usually typically recommend them and then making sure they go to, I usually say there's a children's hospital nearby because, drawing a child is not like drawing an adult. The veins
Yeah.
aren't in the same place. And if you get a phlebotomist who doesn't know what they're doing with a pediatric blood draw, they'll never want to get their blood drawn ever again. And it's a
Yeah.
nightmare and it's sad. The kid's crying. You got to pin them down. It's a mess. So,
Yeah.
blood tests of vitamin D and zinc, just some basics. And then if their child's really young, you can't draw much blood anyway because you can't draw too many vials because of weight. Have them come back in a couple weeks. And then we're like, okay, how did the diet stuff work? What did the homeopathic do and not do? The next step is literally basics. I end up putting them on a high quality multivitamin mineral that not a gummy, because again, you got to just eat too many of them, and some of these better assimilated forms of nutrients aren't stable in gummies, so they just oxidize and go bad. So, and I don't want to give things like cyanocobalamin, and I want to give more of the active forms of nutrients because they work better and you could use them at lower dose. So I give a multi, fish oil, probiotic, and then they come back usually in about a month after that. So their third visit is, 6 to 10 weeks from the first one. And then I'm like, all right, what's left? What things do we need to tweak? And usually they're 90 to 100% better, like they have no more symptoms. So then that's when we start talking about long term, like let's start working on getting some better diet, stabilizing blood sugar. Here are some options. And because of just time, sheer fact of time and how the way I bill, that if they really need a lot of help, I have nutritionists that I refer them to that can actually like walk through
Okay.
meal planning and more appropriate things versus them shelling out the money per hour to have me start doing. I'll do a lot of the basics and guide them. And then they're doing so much better, we could start tapering the doses. But there are times where, say, they're only 80% better. The homeopathic work great, these work great, but they plateaued, so I don't need to give them any more of what they're already on because they're already at therapeutic doses. So then I might start having to bring in other things that are, say, more of a band-aid. They don't have a permanent fix like L-theanine and GABA, these inhibitory
Okay.
neurotransmitters, or it's scary, but using low dose lithium,
Okay.
not lithium chloride or carbonate that you would see in bipolar disorder at 600 to 1800 milligrams. We're talking lithium orotate, which is better bioavailability and doesn't have any adverse effects on the thyroid like other lithium. And you're talking about like 500 micrograms, right? Or
Mm.
up to like a milligram. And that's nice because as that builds up in the bloodstream, it gets intercalated in cells because it is a mood stabilizer. So they don't need it long term, or they might just need it as, kind of PRN as
Yeah.
needed for symptoms. But, I always tell people you'll get tired of seeing me before I run out of options. But usually they're fine, usually by the third or fourth visit. Even in adults, they don't have any more symptoms. And the teachers have been thoroughly convinced that they're on meds, but they're not. And then if they are on
Yeah.
meds, I can taper their meds. You can't just abruptly stop any of these medications that they're on. I'm like, as a professional courtesy, I'm like, go back to your original prescribing physician, tell them how much better the child's doing. And then, or I can write a letter or call the doctor and have them start tapering because I don't want a doctor messing with my treatment plan. Why would I just start messing with someone else's? Plus, there's
Yeah.
medical,
Right.
legal liability. And once in a great while, they kind of get into a little bit of a kerfuffle with the prescribing physician. I'm like, it's fine. That means that
Okay.
doctor's not for you because they're not looking out for you and your child's best interest. I've got a
Yeah.
whole
Right.
referral network of GPs. You want one that they play nice and they play well, and or maybe in the interim, then I start tapering until we get them to a new clinician.
Okay. Okay, so let's unpack that. So the first thing you start off with is nutrition, and the big one that you go for is getting out artificial colors, artificial flavors, and food preservatives. And then I assume you work on getting them towards more of a whole food, nutrient dense diet after that.
Yeah,
Is that
exactly. I
is that
try to
right?
include
Okay.
some things. I'll make some suggestions. Like there's a great thing I don't know if my wife created or what, but basically I usually do vegan protein, chocolate protein. I'm like, does your kid like chocolate ice cream? Yeah. Okay. They like Wendy's Frosties. So you just literally you get a frozen banana, one or two bananas, you break them up, put them in a blender, put in some milk. And we do talk about allergy elimination diets because, gluten and dairy and whatnot, but that's later if we need it. You know, but there's so many almond milk, for example. Put some almond milk in there. Put a scoop of this vegan. I like any protein, but I like the vegan protein powders in this scenario because they're more palatable than say whey, or they might be sensitive to whey, or the beef proteins. And then you blend that up, and there is a high protein, snack and drink that I have yet to have a kid that will not drink these because it's basically you just tell them it's a chocolate milkshake and they don't know the
Yeah,
difference. And you
right.
can put all sorts of stuff in there.
Yeah, yeah. No, I know we've done that too. I mean, chocolate and bananas blended up, are
Yeah.
are delicious. So you're working on nutrition, you're getting basically all the artificial additives out of their nutrition. You're
Yep.
checking labs. You mentioned vitamin D and zinc. Are you checking other blood tests?
Typically magnesium, because magnesium's
Okay.
nature's anxiolytic. That's a natural anxiolytic. Also, it's a cofactor. What we know in studies that it's a cofactor for at least 300 biochemical processes in the body.
Yeah.
I just saw an article that now there's more than 500, and
Yeah.
every reaction in the central nervous system takes magnesium, and B6 as a cofactor. So I
Okay.
want to start. It's a type of modality called orthomolecular medicine. You're literally giving almost pharmacological doses of these nutrients to push those biochemical pathways in a certain direction. So I'll test magnesium, iron, and glad you brought that up. So it's not just a CBC. I've had plenty of doctors, even adults, right? They run a CBC and they're like, your hematocrit, your hemoglobin's normal. You don't have iron deficiency anemia. Well, there's stage 1 anemia, there's stage 2 anemia, and the body's always going to rob Peter to pay Paul. It will keep pulling from iron stores and to make hemoglobin and hematocrit normal, right? And
Right.
RBC's normal. So if you really want to know someone's iron status, right, you need to run an serum iron, a ferritin, a transferrin, percent saturation, and a TIBC. These are iron panels with a ferritin. And you
Yeah.
can see that they may not be completely iron deficient, but you can be iron insufficient when ferritin drops below, say 25 or what have you. The drawback of saying children is that there's usually not good standardized reference ranges in a child than there's an adult, but you can still go by clinical symptoms, what's their diet, physical exam, right? Do they have pale sclera? Do they got pale gums? Those kind of things. So looking at thyroid, iron, vitamin D, zinc, magnesium, and magnesium is difficult because it's just cellular, but you can run a couple. Sometimes, depending on the weight, I will run some B vitamins like B6, B12. As you know, humans in general, we're very empiric people. We like subjective data. So and objective data. So if you have these labs, they come back abnormal, the individual is much more likely to be adherent to the treatment interventions I'm implementing than if they've got nothing. Because they
Because
know
you have objective data to
that's right, and I'm
say
gonna
that, hey,
test you
there
in
is a
3
problem
months.
here.
That's
Yeah.
right. I'll be like, "Look," and it's pretty. I would say most often, iron is low. Thyroid,
Okay.
I pretty rarely I see thyroid off. It's not just a TSH, right? I'll run a TSH and a free T and a free T4 to actually look at the actual thyroid
Yeah.
hormones. And
Yeah.
sometimes those do need to be split up to 2 separate blood draws because they're too small. But at the end of the first visit, I'll say, if has your child ever been drawn for blood? Depending on the answers, whether I'm gonna have them do labs between the first and second visit. They're like, "No." I'm like, "Well, let's just do some basics, have you come back, and if there's no improvements, because I'm still gonna do the diet stuff anyway, but those labs will inform me whether I need to bring on supplements." Like, one of the leading causes of death in a child under the age of 6 is iron overdose, right? So I'm gonna give someone iron unless they really need it.
Yeah.
It could be dangerous.
Okay. Yeah. Okay, so you're working on the diet like we talked about. You're drawing blood on the first or the second visit depending on
Yep.
your read of the patient basically. And then you talked about homeopathy, which is something that many people might not know what it is. A lot of people have actually probably used it, but they still don't know what it is. Can you explain it to us? Because if we try to explain it from a physical and biological standpoint, it's hard to understand why this would be beneficial to human biology. But I'm
Yep.
hoping maybe you can kind of wrap our minds around what homeopathy is and why you think it works in ADHD.
Right. So, yeah, the first visit's always diet, homeopathic. And then second visit, especially if I have labs, it's a little more diet. And then, yeah, multivitamin, fish oil, and usually a probiotic, especially what the
Okay.
labs will show. And then iron if I need. The way homeopathy works is that it's an interesting modality because it's the most popular and utilized medical modality in the world. It's the most contentious medical modality in the world. And the reason that is just like you said, so you've seen these numbers after them, the 6X and the 6C and the 12C and the 30C, is because once you get past a 6C, which is the amount it's diluted, you're beyond what's called Avogadro's number. And if we all remember from our really boring chemistry and physics days of school, that has to do with once something's beyond Avogadro's number, there's no physical molecules left of the original substance. It's too diluted for anything to be there. So that's why the naysayers come about, which I get it, right? That, well, homeopathy can't work because you're beyond Avogadro's. There's no physical substance left. That is true to the science that we know today. But if you look at quantum physics and quantum mechanics, those are nanoparticles. That's what it's looking at, right? Things that shouldn't really be there. So I think once we get better and more advanced at quantum physics and mechanics, we'll understand homeopathy better because they're nanoparticles. They really are working. There's been studies out of Germany, which is a big homeopathic country that likes homeopathy, uses a lot. There was an interesting study that came out where these physicists looked at homeopathy and all these dilutions, 200C, 1M, 30C, and they went to disprove homeopathy. They went to say, look, there is nothing left. And they themselves had to publish this paper because their minds were blown that they're like, this is physically impossible. There's no molecules left, but they put them through whatever torture that these amazing theoretical physicists and applied physicists did. And they showed that even past 6C, there was still something left. There was an imprint on these, like kind of how like CERN and the super collider, they have ways of their instruments to detect them. So they said, look, we're not proving homeopathy. We're not saying homeopathy exists. We're saying that there is something beyond Avogadro's number and these nanoparticles, and we're not sure why these are actually still showing that there's something. And so that was pretty interesting. But if you look at medicine, doesn't matter the medicine, people say all the time, well, in naturopathic medicine, you don't know how your medicine works. And it's like, I mean, and again, I prescribe medications all the time. And my response is, well, you don't know how your medicine fully works. And people will, they'll huff and haw. I'm like, tell me how aspirin fully works. Tell me how, giving something like Tespidera to someone who has progressive multiple sclerosis and its mechanism of action is that it upregulates NRF2, which, has the cascade effect of increasing antioxidants. How does that work in MS by being
Yeah.
anti-inflammatory? We don't know how most medications work. So
Yeah.
don't give me that. And then they'll say, well, it's the placebo effect. And that, never underestimate the placebo effect, right? Because that's a powerful
Mm,
system of medicine. There are
it is.
studies, there are surgical studies where we show OA studies where they've done debridement on people who have OA and they've done fake sham knee surgeries, real knee surgeries, and those that got the sham knee surgery actually had better outcomes than those who had the real knee surgery. So surgeons are like, what are we doing? But I digress. So homeopathy is that the theory is that it's past the 6C. At least before 6C, it's working on some kind of oral tolerance, right? You're putting it in your mouth, there's a physical substance left. It's inducing the immune system via oral tolerance. Well, how is it working past that? It's considered an energetic medicine that we don't fully know. I think, again, it's working on nanoparticles. It contains nanoparticles working on cell signaling pathways. And even many drugs are going into the nanoparticle world versus, okay, instead of just blasting you, let's actually get inside of a cell and start turning on DNA and gene transcription. I think homeopathy is working the same way. And then for the naysayers that say, well, it's just placebo, I'm like, okay, so say I have a 2-month-old and they are covered in eczema. They have severe atopic disease, right? And I give them these sugar pellets. And 3 weeks later, they have no eczema. That 2-month-old had no idea what I gave them. How did their eczema go away? It wasn't
Right.
spontaneous remission of their eczema. Oh, well, maybe the mom, because the mom was breastfeeding, decided, nope, mom didn't change anything in her diet. I literally had no confounders. I just gave them those pellets. And I've done this many times. So, there's ways to kind of push all these things aside, but it is very contentious and I get it. So, in the way homeopathics tend to work, and there's different kinds of homeopathy. There's acute homeopathy where you bang your arm and you go to the store and you grab something called arnica, right, which is classic for bruising. Speaking of arnica, I have a cousin who was an ER physician in Colorado. He's since retired, but he said that there were the studies on arnica in the ER in the trauma center were so robust that it was showing equivalency to certain pain meds and also speeding healing, that the only homeopathic that they actually was approved in the formulary in the ER at that hospital in Boulder was arnica. But no other
That's very
homeopathics work. Only
that's very
arnica. He's
interesting.
like, yeah,
Yeah.
and he was like, so we're sitting there literally giving patients arnica in the ER, but
Yeah.
nothing else. I was like, well,
Better
you got to
than
start somewhere.
opioids. If you can find
That's
something,
right.
and alternative to opioids and do it.
There's acute homeopathy. Sorry, then there's the shotgun homeopathy. These are homeopathics that are in all the stores. They got like 40 in there, and I see this a lot with patients. I bought this, and they'll bring the box in or show it to me, and they're like, it didn't really work, or some will say it helped a little. And the reason that homeopathics may or may work is that everybody's individual. So maybe one of those 40 homeopathics was what that person needed, and that's why it worked. But most of the time, those don't work. Versus the studies you and I have been talking about where homeopathy has been shown efficacious. That's constitutional homeopathy, where you match the physical, mental, and emotional parameters of an individual to a particular homeopathic medicine. And there's about 5,000 homeopathic medicines in the world. In clinical reality, there's 100 that are quite common, and then there's another 50 that are really, really common, and then like 35 of those are called polycresses, which is what most everybody are. So you just have to match that person and their personality and their traits and their symptoms to one of those medicines, and then you give them the medicine and they dissolve it. And what's nice is that it's quite curative, that it will fix their ADHD. It does wear off eventually, and then symptoms come back, so you just redose it. And I think it's just mostly optimizing someone's genetic potential, but it's the number one tool in my armamentarium for pretty much any health condition. I'm using medications and supplements and herbs and stuff, but homeopathy gets the quickest results I've seen and the most long-term effects. And then sometimes you miss on the remedy. The parents come back and they're like, my child is no different. That's fine. That means I missed and I got the wrong remedy. So I'll give you a different homeopathic medicine because I have usually a
Yeah.
differential of 3 that they'll most likely be.
Yeah. So what does the data specifically say? Have they done clinical trials on this showing how homeopathy works on ADHD? I mean, have they specifically studied this?
Yeah, it's been studied quite a bit. And there are a number of studies that show no improvement compared to placebo. And those are poorly controlled studies, and they're also poorly performed studies. So the way constitutional homeopathy works, and I put it in quotes because that's a particular type of homeopathy, which is a type of classical homeopathy. Homeopathy has been around for over 200 years and was invented by a medical doctor. This whole like treat like cures like kind of deal, where you give a low amount of something. So say someone has ADHD and they got 50 subjects that have ADHD and they all have kind of similar symptoms or a lot, and then a bunch of disparate symptoms. And everybody gets the same homeopathic or they get placebo. And then, the statisticians go through everything and they show that, oh, only 20% of these subjects responded. Therefore, even the p values were good. Therefore, it was no greater outcome, right, in clinical effect than placebo. And that's true because that is not how homeopathy works in clinical reality. So the studies, and it's not just ADHD, it's a number of other conditions, our arthritic conditions, autoimmune diseases, mood disorders. I mean, it runs the gamut of health conditions. Is that when you actually do these trials like they're supposed to be done, and like how it's done in real world, where they get whether it's a homeopath or a doctor who's deft and and well skilled and trained in homeopathy, they might get the same 50 subjects and they will get, and all of those are getting 25 get placebo, 25 they might be getting 10 or 15 different remedies because it's personalized medicine. So why one person might need phosphorus, another person needs metarhizium, another person needs carcinosin, another person needs natmir. You could see where this is going. Then all of a sudden, and the person who's giving the medicine, because they're double blind and randomized, placebo controlled, nobody knows what what the subjects got. The person who prescribed the medicine doesn't know whether they got the real remedy or they got the placebo. And then when you actually go
Yeah.
back through those trials, and there was a trial, a head-to-head trial in 8 and 9-year-olds where they put them against. I love these trials where they go against gold standards. So they either gave them, it was a 3-arm trial. They either gave them methylphenidate, a constitutional homeopathic remedy, or placebo. And nobody knew what anybody was getting, right, except because they didn't unblind the trial. And they showed at the end of this trial that, and it was statistically significant, that the individuals who got the constitutional remedy did just as well as those on methylphenidate with no dropouts, because the methylphenidate group did have dropouts due to side effects. And it was superior to placebo, and it was equivalent in subjective and objective parameters as the actual medication. And even the authors of the study were like, we recommend, starting a trial treatment with this. And even in the crossover study, right? Then same one, they then switched the two, and then people who had methylphenidate got the homeopathic, and it still worked. So to
Yeah.
me, that's pretty good efficacy and statistical significance in a trial.
Yeah, I've read that study. I mean, because that was a very strong, well-designed trial. And yeah, I was totally shocked. I mean, there was actually a pilot study up before that trial that showed that 75% of kids who took these homeopathic remedies had complete resolution of their ADHD.
Yeah.
So, and they don't know how it works, right? Still,
Right.
so
Nope.
and that's what drives the medical community away from it, because it's just, when I was in residency, was doing research in a lab, and I was growing glioblastoma cells in a petri dish, in a cell culture dish, and glioblastoma is a very aggressive brain tumor. And then I was dosing them with tiny, tiny amounts of curcumin, which is the active component in turmeric. I mean, amounts that were so small that it would be the same concentration that you would get from eating like a bowl of curry, essentially, with
Okay.
turmeric in it. And these glioblastoma cells would just die when I would put the curcumin and these concentrations in there. And the dish next to it that didn't have the curcumin, just had a placebo, would proliferate and just grow like crazy.
Hmm.
And so I took this to my professor at the time. I was like, "Hey, look what I found." And he's like, "Well, how's it work?" And I said, "Well, I don't know. We can
Right.
try to look into that, but it does work." And he's like, "It doesn't matter. If you don't know how it works, it doesn't really matter if it works." That's science, but still, it's a dogmatic way of thinking that medicine has, where if you don't know why it's happening, it doesn't matter that it is happening. And
Yeah.
I think homeopathy is a great example of that. It works. And maybe people can say it's just an excellent placebo delivery. And I know they've done studies over that specifically, but even if that was the case, it still works, right?
Exactly. What
I
does it
mean,
matter? It
placebo is
still works.
better than most drugs that we have, So
Right.
if you can efficiently deliver placebo, great. I know all the homeopathy doctors out there are listening to this and hating me right now for saying that, but
Oh, yeah.
if it works,
Yeah.
why not?
Exactly. Yeah. And I mean, I'll get burned to the stake for all, a lot of the stuff I say. And I don't repertorize, and I don't do it like the traditional 2-hour intake. And people, when I speak at medical conferences, doctors are like, well, how are you incorporating all of it into the visit? I was like, children are usually only like 45 minutes, right? But adults are 60 to 75 minutes, 90 if they're really, really complicated for a first visit. By the time I've gone through, the history of presenting illness, and I've gone through the normal, usual mumbo jumbo, I only need to talk to them for 5 or 10 minutes specifically on homeopathy, ask them specific open-ended questions and closed-ended questions, because I've got a good differential of the remedies in my head already. I don't need a whole separate 2-hour. Plus, it's a lot of noise with a lot of the homeopathic type of questions that to me are irrelevant. So they're too narrow for me to basically match the essence of the person to the essence of the remedy. But you're right. I mean, that's also human nature, right? We are constant in science in general. We have to know how something works, and that's cool. I'm a scientist. I like to know how things work, but sometimes we just don't know. And like you said, you're sitting here watching, glioblastoma cells basically go through apoptosis and die because you're giving them curcumin. And we know, well, there are certain ways of manipulating curcumin now in humans that you can get it to cross the blood-brain barrier, but you need in bolus doses, but you could still do it. And, we don't know. There are some theoretical ways, but yeah, people just don't like to use things. Or I ask docs all the time, I'm like, well, how did this work? And people are like, I don't know. It's like, who cares if it worked? Especially if there's like essentially no side effects.
Yeah. So are there any side effects to homeopathy?
Not generally. There's not, I guess it's a quasi or a pseudo side effect, is that what I tell my patients is that there's only really two things that can happen. One, it does nothing, right? I just missed on the remedy completely. The analogy I always give is imagine that you're, or a metaphor, I was like, imagine you're a dartboard, and the bullseye is what's called the simillimum, which means the remedy that treats everything that's going on with you. If I get that, everything's better. But the farther I get out from the bullseye, the less things that improve. So you might come back and be like, A, B, and C got better, but this other things, that means I was too outside the remedy, or I need to redose it. But
Yeah.
generally, either it does nothing, or you get what's called, in homeopathic theory, they call it a healing crisis, which I think is too negative, too pejorative, right? So I call it a healing reaction, where things get worse before they get better, but it doesn't last more than a few days. So say you have like a highly agitated, very aggressive ADHD child who also has, a number of health issues, like they're biters, they're hitters, they've been kicked out of schools, they punch their parents, everybody walks around eggshells around them. I do warn them that that may get worse before it gets better, but it doesn't
Mm.
typically last more than a week, and it shouldn't. And if it does, they need to reach out to me. because either the most often what happens is the remedy was too strong. So you just give them a lower,
Okay.
make it wear off and then you give them a lower potency. So over years of practice, I I usually give a lower strength over a period like every day. So that mitigates the probability of the child now, because then, yeah, obviously parents are not happy with me when they're like, thanks.
Yeah.
My kid broke the TV, they busted their Xbox, and they got in a fight at school. You suck. You're fired. I'm not, I'm not going to see you anymore. I'm like, I warned, like, I don't care. You warned me.
So
I didn't
what's
like
the
what
theory
happened.
behind that? Why is it that a remedy would cause them to get worse before getting better?
I think it's similar like how some medications, right, make people worse before it gets better. That's just like, particularly SSRIs, SNRIs, is that it's like this. The theory, again, it's all theory. It's not law. It's almost even probably more of an hypothesis, is that the way homeopathics are working is a constant level of balance. So if you have that super aggressive person, it's trying to bring you down to here. If you got that like super mellow person who's like tired and brain fogged and fatigue all day, it should bring you up here. So it has like this teeter totter. And over the years, I've had a lot of patients describe it, older people, like adults who can explain things better. They'll describe it like as a roller coaster up, and it goes like this, where the ups and downs, the pits and valleys are larger apart and for like a week. And then there was this new baseline where like everything was great. But they'll say, yeah, that first week was not fun. I'm like, sorry. It doesn't happen every time. It only happens sometimes. And I've tried to gauge the type of person, and I'll ask them, are you sensitive? Are you sensitive to medications? Are you kind of sensitive to supplements? And they'd say, yeah, I don't go with those higher potencies. So one theory is because it's working on a person's like vitality, because it's an energetic medicine, is that say you have a super high vitalistic person and you perturb the system, that system then inside them pushes back equally hard. So just the same reason, like say you have a very depleted, like say you have a cancer patient who's very ill. What we learn in homeopathic classes in med school, the theory is that you do not want to give them a really strong dose because they don't have the vitality to keep up with it, and you could actually do more harm than good, right? You know,
Okay.
as we always learn in medical school, do no harm. So you give them the lower strength, but homeopathy, yeah, it just is not well understood outside that 6C. I think it'll until quantum physics and is better understood. It's always going to be the devil child, you know, and people will shy away from it. But I could tell you that it is the number one tool I've seen, like people with autoimmune diseases, to stop their flare or mitigate a flare. The
Uh-huh.
child who's the asthmatic, their asthma goes away, their seizures get better, the ADHD gets better. But it's not the end all be all, right? You still have to do all these other pieces because it has its limitations. It's
Yeah.
not the magic pixie dust.
So do you have to, once you start say you take a homeopathic remedy, you get benefit, say with ADHD or one of these other problems you're talking about, do you have to stay on it for the rest of your life?
No, that's a good question. So these homeopaths will just be cringing when I say this, but many people believe, traditionalists, that you're a homeopathic remedy, basically. That's your similum, that's your true remedy for life. And that doesn't make any sense. You can't tell me that you're the same person as a 10-year-old as you are as a 30-year-old. You're a totally different person. Yes, you've got those traits and some similarities, but you're a totally different person. You're in a different phase of your life. You're in a different state of your life. So how could you possibly be the same homeopathic? So, and then in homeopathic theory, you have these pathological remedies. These are like the aggressive, the biters, the hitters, because since we're talking about ADHD and conduct disorder and those things, they're going to be a much more aggressive, deeper state remedy that they will eventually move out of. And I can't tell how many parents I've had like literally crying in my office with joy because they're like, I got my kid back. My kid was 6 years old and they were huggy, lovey, social. Now they're 12. And it's more than just preteen angst and puberty, right? I mean, they're going to boarding school because I can't take them anymore. And
Yeah.
they've been kicked out of all schools and they won't do their homework. They're failing. And then you also got to look what's going on at home and there's other aspects, but see where I'm
Yeah.
going with this. So then you give them that homeopathic, all that goes away, and then those symptoms come back, you redose it, or what most likely happens is that they only usually need the remedy 1 or 2 times, maybe 3, and all of that goes away, and they move into a healthier remedy. They don't need that deep, dark pathological remedy anymore, and they
Okay.
might stay that remedy for years until they kind of, go through puberty or they get in their
Mhm.
20s and now they might be a different homeopathic medicine. But no, they don't. I've had people that, and usually the remedies, every time you give it and they get healthier and healthier, there's less things for the homeopathic to fix. Plus, with
Yeah.
me, I'm doing so many other things that they don't usually need it right away. They might go 3 months or 4 months. I've had some
Yeah.
patients who have mood disorders or even ADHD where it's like a year later, they might be seeing me for something else. I'm like, well, how's this and this? They're like, that's not a problem. Do you need the homeopathic again? They're like, no. That's unusual to last that long, but it does happen where I got people that are like, nope, my depression, dude, I feel great. I was like, wow, by now you should normally need it again, but you don't. And it's the antithesis of what we understand with all medicine. Less is more, right? We understand like loading doses and high doses and tapering and prednisone tapers, and homeopathy doesn't work that way. It's the less is more. So you actually, that's why the whole time when it's past 6C, these 200C, 1M, when it's really diluted, those should last a very long time. So you don't want to take them very often. And that's counterintuitive to how we think as probably a human and Americans. We're like, more is better. No, not in the world of homeopathy. And that's hard to get around that psyche. Even myself, I'm like, do
Yeah.
you need the remedy? And like, nah, feel good. Okay.
No, it's counterintuitive, But
Yep.
so let me clarify something. So are you're changing their prescription as their symptoms change then?
Yep. Yeah. Lots of
You're
follow
starting
ups.
them on one remedy, and then you're changing the prescription to a different remedy if they need it?
Yep, exactly, because
Okay.
they won't need that anymore, especially if I got the remedy. I'll give you a great example. There's plenty of times where I've got the hyperactive, aggressive child who is highly precocious, and I mean, you think you're talking to an adult, but they're very
Yeah.
mouthy, they're very lippy, and they're very irritating, even even into a clinician. But you got to keep your composure, right? And there's a classic remedy for them called Baratralmalum. It's made from a plant, and so these are kids who are extremely haughty. They are well aware of their intelligence, right? And you got to be careful of what you say and do because they will call you out on it and be like, well, 10 minutes ago, you just said this. And you're like, oh my God, this kid's 10.
Sounds
So,
like all 4 of my children, so
well, they do have a neurosurgeon as a father. So I'm sure they're quite intelligent and mouthy. Yeah, my kids, the three of the four got a mouth on them. Even our daughter, our youngest is like more regular. But so you give them the homeopathic, and the parents will come back and be like, this is crazy. And the classic thing that most parents will say is this: we all feel like we're walking on eggshells around our child because anything will set them off. These are major behavioral issue children that make it difficult to be around them, make the child have difficulty with maintaining friendships, right? They're challenging people. And that's sad, right? Because you want them to be a child, even in adults. It's mostly given to children, but you will find adults and they kind of present a little bit differently. But you give them the remedy, they do a lot better. And then say a couple months goes by and the parents will usually reach out and be like, we're having some issues at school and this is coming back. You give it to them again. And then 6 months goes by, a year, they're totally fine, and or they have new symptoms that come about or
Mm.
new issues, but all those original ones, and then you give them a different homeopathic remedy because they don't need that one anymore, it won't work.
Yeah. So I was assuming that this is regular dosing, like a regular dose medication. Are you talking about one-time doses, or are you saying you give them a course and they stop and then you try a different course?
It depends on the person. So, like, usually what I'll do in children, usually what I'll do is I'll give them a medium strength, 200C, or a higher potency strength, which is called a 1F. And that will usually last at least a month. So, it's
It's a
all
one-time
individual.
dose? It's a
One-time
one-time,
dose.
and
Yep.
then it lasts them for a month?
It usually lasts the first time, it usually lasts about a month.
Wow,
And then
okay,
the symptoms, they won't all come back at once and they won't come back full throttle. The parents will say, I'm starting to see some issues again. So then
okay,
I will give it to them again. And this time it usually lasts much longer. Sometimes what will happen is like I have a patient that I'm thinking of that it was referred to be like a lot of cases that a very violent child, very aggressive. He was a very different type of remedy, but a lot of, these are the individuals that you get worried about that honestly become school shooters. Very
okay,
aggressive, very
okay.
violent, punching the mom in the face. And this
Oh,
kid was
man.
14 years old, punching the mom in the stomach. His dad was 6'8". He's getting into fights with his dad. You don't want to fight a 6'8" man, but he was a big kid too. His dad's 6'8". His siblings never leave the bedroom. They're scared of him, right? So this, you can see where it's going. So gave him a remedy called stramonium, which is a very dark and violent remedy. Worked really, really well, but it only lasted like 2 weeks. And you'll see this a lot. So something is making the remedy wear off too quickly. And in homeopathy, less is more. If you keep giving those high potencies too frequently, that could make the remedy stop working because the body in its inherent wisdom is like, I've seen this before, kind of like how we build tolerance to medications. It's like, this
Yeah.
isn't going to work. And now we're in a little bit of trouble because one of the other homeopathics may not work. So that's when I will switch to either a daily or a couple times a week homeopathic, but at a much weaker strength where it's meant to be taken every day, like a 6C or a 12C.
Yeah.
And that way, it's almost like taking their medication every day, where the parents will even say, if I don't give them that 6C, 3 pellets or whatever, and I miss a couple days, I notice that these behavioral issues come back. And they usually don't need those long term either because it's just slowly nudging the system to kind of fix itself. Plus, I'm intervening on a whole bunch of other things. I'm not just like, here's your homeopathic, see me in 6 months. I'm like, we got to look
Yeah.
at this, we got to look at this, fix this. I like to go for the cure whenever possible for any health concern. And those will be dailies or twice a week or 3 times a week. Learning disabilities also, I forgot to mention, that's really common in ADHD that gets overlooked is a lot of dyslexia, sensory integration disorder, apraxia, agraphism, right, where they write, and so naturopathic medicine, along with behavioral therapy and occupational therapy, right, is really well equipped at making that brain, when it's so neuroplastic, work better. And I've done it plenty of times where all of a sudden their test scores shoot to the roof and they drop their IEPs and they're out of special
Wow.
education because it's been supercharged by, all of these wonderful ingredients that most people don't have training or poo-poo it, so to speak.
Yeah. So you're saying that these kids with ADHD who are presenting with potential learning disorders actually have cognitive abilities that no one realizes that are being basically prevented from coming out and being utilized because of the ADHD. And as soon as you control that, they go back to basically normal and maybe even excellent academic ability.
Yeah. I mean, so I've seen kids, and studies also bear this out, is that, and I've worked with clinical psychologists all the time and PsyDs, that do these assessments, that the ADHD is the predominating symptom. They don't, it's like when people think dyslexia, it's like the classic dyslexia, right? Is the transposing the letters or the numbers or the words. It doesn't necessarily have to be like that. It could also be a processing disorder, right? Where their brain isn't interpreting it correctly, even if their handwriting might be totally fine, something like that. So the ADHD is the
Yeah.
predominant thing. They're all they see, they being the teacher, the parents, is that my child is really hyper. My child, even when
Yeah.
I'm talking to them, you can see them like kind of, they drift, they go out to lunch. So all these other things that are getting neglected, and then now they can sit and focus and they're quiet because they're on stimulants, but yet the problem with their learning disabilities hasn't come to fruition or hasn't been assessed or hasn't been noticed because they might be mild to moderate versus, yeah, I mean, the agraphism is pretty obvious, right? When you look at someone's writing, you're like, that makes absolutely zero sense. But maybe they write fine, but then their brain doesn't interpret it. I like clinical psychologists for neuropsych evals all the time to get all this stuff elucidated. Plus, those say what kind of non-drug, non-pharmaceutical interventions should be utilized, and insurance covers it because, way it was pre-auth. But yeah, you'll see all of these things be fixed because it's one thing if they bring a 25-year-old comes to me with these issues. I'm like, well, that's a little harder because your brain has made those connections. But 6, 7, 8, 9, 10, 12-year-old can totally be undone.
Yeah. Well, that's pretty like fascinating and very hopeful, honestly, to hear something like that. Okay, so let's jump back to your protocol because we took a big side quest on homeopathy. But just to review, you start off with nutrition. You cut out all the artificial additives to food, and you
Yep.
also on the first visit you start off with a homeopathic remedy. Then on the second visit, you reassess, you might change your homeopathic prescription, and you potentially check labs if you feel like things aren't progressing in the right direction. And
That's
you
right.
add supplements, which we talked about omega-3 fatty acids, magnesium, vitamin D, a multivitamin, which I'd like to hear
Yep.
more about. And then you continue with different assessment and following that patient and making sure they're headed in the direction that you want them to go. Is that right? Does that sum it up, or did I miss something?
That's pretty much it. And if I miss on the homeopathic medicine, the second time I see them, I will hold off on that and I'll just do the supplements because I know those are, say, more predictable. Like, what if I miss a second
Yeah,
time? The parents aren't going to want to wait around for me to keep trying different homeopathics. I'm not a homeopath. I'm just
yeah,
a naturopathic physician who uses a lot of homeopathy. Plus,
yeah,
I don't like to throw too many things in because then what if something went wrong? I won't know what did what.
yeah.
I occasionally, not that often, but I will get some patients that are like, we're not comfortable with homeopathy, just its premise. Okay, that's fine. I don't have to use homeopathy. I usually make my case for it, but I want to do with what you're comfortable with. I could still do all these other things and still get some good results, and we'll go with that. So it's usually the first like 3 appointments, 4 appointments is a lot of diet because it takes a while to get their diet improved and get them on board. Like adults, right? Is that diet's difficult, but
Mhm.
once you get someone better and they see the results, because I'm definitely a results driven position. I like to work fast. They'll usually do whatever I recommend now, even if it's
Yeah.
difficult. Like, and I said, look, you missed a day, you forgot the supplements, you didn't get the fish oil, that's fine. It's not the end of the world. But don't kind of come crying to me when you're like, well, they're no better. And I check back and they only gave them the supplement once. Well, that's not going to work, right? It doesn't work like that. You have to constantly get it into their system, especially in the beginning. We need loading
Yeah.
doses because they're so nutrient deplete. And then we do talk about, especially if they have gut issues, allergy elimination diets being the gold standard for food sensitivities and intolerances, and there's a difference between those and food allergies, et cetera. So it's a lot of tweaking. And the way I do my appointments, no matter really the patient for the most part, unless it's like the worried well or someone that's kind of, they're an athlete and they want to just set their game up so they don't need me that much, is everything's front loaded in the beginning, the first like 3 months. So it's a lot of fine tuning, a lot of tweaking, not a lot of appointments. It's usually just 3 appointments, but a lot of like emails in between because unless for me, no news is good news, right? If I don't hear from you, everything's going great. It's all copacetic. Then the appointments
Mhm.
start getting farther and farther apart because usually they're better. And now these other treatments that are slower to take effect, for example, I need time for those to actually work to be able to assess whether they're doing something. And usually
Right.
I'm not a heavy-handed supplement provider, so usually it's everybody baseline pyramid, the multi, the fish oil, a probiotic, and depending what their labs show, do I a magnesium or an iron or I like to
Mhm.
combine as many things at once. So the multivitamin's gonna have everything I need, but the zinc and the vitamin C and the D and all the adequate stuff. So that way it's just like, scoop a day or something
Yeah.
like that.
Tell me about your multivitamin because this is something that, most people who take a multivitamin, it's like a Flintstone or a,
Yeah.
Walmart brand, generic. Do those work or do they need something special?
You know, it's like, generally speaking, something's better than nothing, but there's a caveat to that. So, I'm a subject matter expert to the dietary supplement industry. I consult and advise a lot of companies, and there's a reason that the dietary supplement industry gets a bad rap, right? But there's a misnomer that, oh, the dietary supplement industry is unregulated, which is farthest from the truth. The dietary supplement industry is actually heavily regulated. It's poorly enforced. The FDA only has so
Yeah.
many field agents because they have to do food, drugs, manufacturing facilities, the compounding pharmacy industry, dietary supplement industry, the contract manufacturing facilities that make the dietary supplement industry. And so they can only police so much. And unfortunately, how it works is the opposite of the FDA, right? It is the opposite of the drugs. Pharmaceuticals have to prove safety first, then get it out in the marketplace. Where natural substances, as long as they're not banned, it's the other way around. You don't have to prove safety so much is that you just have to prove that it's not going to kill someone and it's got what's called GRAS status, generally recognized as safe, or what they call self-affirmed, which you can do it. So and the FDA only steps in when something goes wrong, and then people report it to MedWatch, whether it's a hospital or it's a person who consumed it. So the policing, unfortunately, is weak, and that is not good for obviously public health and safety. The other problem with the dietary supplement industry is that a lot of the reasons that they don't show good clinical outcomes in many trials is that they're poor quality. So poor bioavailability of nutrients, they're in too low of a dose. Lots of supplements are either contaminated, fraudulent, or they fail to even meet label claim. And Amazon's a big culprit of this.
Yeah.
So you'll be amazed when you actually take a person who say, has taken a Centrum multivitamin, and like, I take it because I'm supposed to take a multi. I never noticed anything. And then you give them one of these high quality ones that cost $20 more. Their mind is blown. They're like, oh my God, I have so much more energy. I can think, I
Yeah.
can focus. And it's because you're using things that the body utilizes much better than what you had before. And Flintstones, I grew up on Flintstones chewables, right? I mean, those are great. Yeah, but they finally do make a version that doesn't have anything artificial. They do make a gummy, and the forms of the nutrients aren't the best. But you know what? For me, that's all the kid's gonna take. For example, I will
Yeah.
recommend one of these lower quality, if you will, but at least they don't have any of the artificial in it. They don't have fructose corn syrup because it's some is better than none while I'm still trying to buy myself time to get more foods into them. Or I have an autistic child who's got super tasted versions, right? And they're like eating four things. And so I'm like, well, at least I can get this into them and make
Yeah.
sure it's actually doing it. But so when you see these trials, like there was one that just came out a few months ago that showed no overall decrease in mortality, morbidity, basically had zero. And and I'm not knocking Centrum, but the study was done on Centrum. And there's a reason that you won't see those, but you look at other trials, you do show efficacy is because Centrum it's not a poor quality company. If you just look at the back, it's like zinc oxide, cupric oxide,
Yeah.
cyanocobalamin. These types of molecules, the body does not really absorb much at all.
Right. Yeah.
Yeah.
Yeah, I know.
Hopefully
It's
that helps.
exactly, and people don't realize it that they're paying for stuff that they're just pooping out.
Yep.
So what brand, or what do you have your own formulation? What are you using personally, and what are you giving to your patients?
Right. So in my practice, I use probably 25 to 30 brands. I'm very
Okay.
particular about the brands I use and the actual specific products that I use because it's just my personality, right? I'm very particular because I want things to work. So there's some brands I literally may only use one or two products because I don't really care for the rest of the portfolio or I don't like the way the formulation is. I have formulated and launched probably more than 100 products into the dietary supplement space via the direct to consumer channel, healthcare practitioner channel, the e-commerce channel. I don't get royalties on any of these. Some companies, like startups, I do have, as full disclosure, I do have equity. Like I was given equity as far as shares to help do all the medical affairs and scientific affairs and claims and all the
Yeah.
regulatory stuff to do the formulas. But I have no specific ties to any particular company. So, in children, and the way this world works all now in mergers and acquisitions and private equity and venture capital taking everything over, it's just that's the way it is, right? Nature's the beast. So I might be using something for a long time and it's crushing it. Somebody buys that company, they look at the portfolio and the P&Ls and they just wipe them out. So just recently I did have to switch this multi I loved for 15 years because it was a powder. You only need like half a scoop and it had, especially with B vitamins, it's kind of hard to mask because they're not very good, right? They smell the way they taste and vice versa. That you could mix it and it didn't really have any taste. So that company was acquired, they discontinued it. So this is like 3 months ago. I just had a patient tell me, I'm like, dang it. So I had to replace it with a company called SFI, and I have no affiliation with them. And they have a great full spectrum. They have a couple multis, but they have a powder that's actually was originally developed by scientists for autistic children. I use it in all children, but it's nice because you know it's third party tested. It's a high quality company, professional line. I think they don't call it Spectrazyme. I think it's called Spectrum Awakening. When you go to their website, they have two powders. One of them is one. It's you can't miss it, right? Because they promote it for
Okay.
autism spectrum and all that. But that powder works really, really well because it's in its coenzymated form. It's in the active form of all of its nutrients. So the body, even if it has these single nucleotide polymorphisms that everybody's concerned about, you don't have to worry about it because you're bypassing those steps and you're already
Okay.
taking it in its activated form. And children don't seem to mind it because it doesn't really have a taste. I avoid the wafers, the chewables because it's chalky. Most kids won't eat them. Gummies are fine. It's just you have to take so many of them to
Yeah.
make a therapeutic. But again, that's all the kid will take. Smarty Pants is another line that will do that, that makes a reasonable gummy that doesn't have anything artificial. And they do have some of the vitamins in there as active forms.
Yeah.
they have a nice one that is an omega-3, a multivitamin all in one. So those ones, the probiotics, same thing. Those are easy, right? And the probiotics, I should say that most probiotics out on the marketplace are total garbage.
Yeah, I would
They're
agree
either
with you on that.
contaminated with pathogenic bacteria, they don't meet label claim, they're not shelf stable. So, and they have dairy in them, and a lot of people don't do well with that. Like, so I just look for a hypoallergenic, dairy-free probiotic, and then sometimes I get into the strain specific if I'm treating something specific. But for the most part, like with little kiddos, I use it's called NBI, their company. He's got one. It's called Happy Belly. So I will use that one, and it's nice. It's got 13 strains, 50 billion, and you just open the capsule, put it in applesauce, put it in whatever you want, a smoothie, a shake, if
Yeah.
they can't swallow pills. And so you just got to play around. I'll usually ask, "Can your kids swallow pills yet?" No. Will they do chewables or powders, liquids? And they'll say, "Yeah." And they usually say, "Yeah, my kid's eating Flintstones." And I'm like, "Well, let's change that," because I haven't seen those do as much unless you give them a lot, and that's okay. I'm like, "Fine, eat 8 of these for the next month, and then we're gonna taper you down."
No, I mean, I think, minerals that are basically conjugated to oxide or reacted with oxide, they don't absorb. So people should, when they're looking at their multivitamins, look for minerals and vitamins that are conjugated to amino acids like
Right.
citrate, glycinate, things like that. Those tend to be better absorbed and more bioavailable.
Yep.
Okay, so let's talk. Let's wrap this up. You've given us your whole protocol. You've talked about the etiology and the current state of ADHD in our country and
Yep.
our world. What results are you getting? What percentage of these kids who come in and you treat are finding some benefit?
I would say, and ADHD, like most conditions, they could run the spectrum, right? You could have mild ADHD, you can have severe ADHD, and,
Yeah.
anywhere in between. For me, it doesn't matter. Again, not to sound like narcissistic or pat myself on the back, but I would say my success rate with people who are under the age of, say, 18 or 20 is 100%. There's no
Oh,
symptoms whatsoever left.
100%.
100%. They might
What
have,
does that
it
mean?
doesn't mean,
Is
so you
are
might
they,
get
like, coming off their meds or they don't
coming
have
off the
ADHD
meds.
anymore? What does 100% mean?
100%, back to like one of those studies, right, where they had these individuals who just did the artificial flavorings and sweeteners. There are studies that when they did this with these kids, they actually no longer met the DSM. I keep saying DSM-4 because these studies were for DSM-5. They actually no longer met the criteria. So I would say 100% resolution. Does that mean they have no symptoms 100% of the time? No, nobody. You and I have a bad day. We might not get a
Mhm.
good sleep. And then you and I actually talked offline about this that you and I haven't talked about yet, but sleep is so critical to just think about if we don't get enough sleep as an adult. We're
Yeah,
irritable, we're brain foggy, we can't think that well, we can't concentrate.
ruins your whole
But
day.
your whole day, think about a child, right? That's why if you're, nowadays, especially because sleep hygiene is not great. Maybe when they're a baby, we're so hyper vigilant with sleep hygiene, but that is critical for memory. That's critical for mood and behavior. So if your kids are getting those 10, 11, 12 hours, especially when they get into that deep sleep, there have been studies where when they actually got these kids to sleep, even if they're just giving them melatonin, they didn't meet the DSM-5 criteria or 4 criteria for ADHD anymore. So they may have some off days, or maybe the parent, like 6 months later, is like, everything has been great. We've had 0 issues. They're totally excelling, but this is kind of coming back and this is kind of come back. You know, okay, well, I haven't seen you in a while. Make an appointment, because you didn't need to see me. So make an appointment and let's just triage real quick. Are these new symptoms? Are they the same symptoms? Is it full blown? Do I need to redose the homeopathic? Like, where do I just need to pick up? And that's
Yeah.
usually what happens. I just redose the remedy. Maybe they fell off supplements. I'm like, okay, amp back up on these and taper them down, like the fish oil. There was one that I used to use, I used again forever. And then Nestle acquired the company that was awesome. In half a teaspoon of this strawberry DHA fish oil. And anyway, you've probably tried these liquids. They taste like strawberry at first and then little back end of the fish oil. But all I needed was half a teaspoon. It was 2,000 milligrams of omega 3s. And that's another thing that fish oil supplements are legally able to do, but it's misleading is, and I see this a lot, I'm sure you have in your practice, is that it'll be like, "Oh, like, I'm taking 1,000 milligrams of fish oil." I said, "You are taking about 1,000 milligrams of fish oil. Look at the back. How many total omega 3s?" They're like, "It's like 135." Right. That's why it's not working. So now you get these super concentrated ones. So I will get these ones like Barleans, no affiliation. They make these omega swirls it's about a tablespoon, but kids love them. They like pina colada and mango, and these kids will eat this stuff up all day because it's a treat. You give them a tablespoon of that and send them off to school with a nice healthy breakfast. Now you'll see a greater improvement. So most people, I would say, yeah, no meds, children and adolescents. Adults, I would say the same amount of success, but it takes maybe a little longer. Like you get results and then they plateau and then you get results. They're not as quick as children because of the reasons we talked about. And then they may just need like one medication and just like a small amount to get them through their workday. But they're not on the 40 milligrams of Adderall anymore, or the Strattera, and they're off the benzos, and yeah, their life is a lot better. And it's the same treatments, just maybe not the same like earth shattering 100%, but they'll maybe get 90% better, and they're
Wow.
like, "This is great."
Well, that's fantastic. I mean, the fact that you can have such a high success rate with kids who would otherwise be put on these stimulant drugs, I mean,
Right.
that's extraordinary. And it's all from these natural treatments that have really no side effects. So that's really cool. I mean, I hope that if people hear that, it gives them some hope that there is alternatives because I know a lot of parents are out there. They're thinking, I gotta put my kid on this stimulant or they're gonna get kicked out of school or
Yeah.
our family's falling apart because of their behavior. That there is an alternative out there.
Yep.
And for adults who are, their life is just falling down because of the inability to pay attention to things or the inability to be productive, there are routes outside of the stimulant category, like what you're talking about, that could help them. And just to be clear, you're often treating these adults who still stay on some dose of stimulant as well, right? So they're not all coming off their medications.
No. Some of them, I would say probably maybe I would say probably 25, 30% do stay on a medication. The adults that come see me, half the time that's what they want. They're like, I have ADHD. The other half the time they have other issues. Like they're coming to me for insomnia, anxiety, depression, all those. And then they're also like, by the way, I have ADHD. And they may not even bring it up the first time. It's on their intake form. I see that's one of their medications. They're on, some amphetamine salt. And I may ask them, but usually what'll happen is say in those cases, yeah, the second or third visit, they're feeling their anxiety's gone, their insomnia is better, their fatigue is better. They're like, hey, I would really love to get off of some of these meds because I think that's what's causing some of my issues. Is this and how long have you been on this? 20 years. I got a 45-year-old right there. They're like, I've been on this for 20 years and I have to keep taking it, but I don't like it. I don't like the way I feel, but it does help me, focus. But I think I'm having some of these other issues. So with those individuals, yeah, sometimes we get them off of them completely, but there's no one, knock on wood, that doesn't at least go down on their meds or come off most
Okay.
of them and just stays on a low dose. I have a patient now, she's was at 20, now she's at 5. And she was seeing me
Mm.
actually for chronic fatigue, and then a bunch of the other things came up, and then, yeah, the amphetamine salts came up, and she just takes 5 in the morning. She's a psychotherapist, and she's like, "This is all I need. I don't have these other issues now." And then she's like, "I think I could get off this too?" I said, "Maybe, but right now things are going well, and it hasn't been that long. You already tapered to 5. Let's just, see what happens in a few months." Because
Yeah.
plus there's that psychology of it, right? You've been taking something every day.
Yeah. Yeah.
You're like, "I didn't take my amphetamine." Plus we're dealing with chronic fatigue and getting rid of that. So she has
Yeah.
chronic fatigue syndrome. So I'm like, it's one bridge at a time.
Yeah. So it sounds like you're seeing complex patients with lots of different problems.
A lot of
Yeah.
problems, yeah. A lot of the health
Yeah.
issues, and that's kind of the bread and butter why people get referred. I get a lot of the regular cases, which are fun because then they're like no brainers versus
Uh-huh.
I like the complicated cases. I like to help people. I like the puzzle. But as you and I were talking earlier with some of your neurosurgical surgical cases, it's like seeing those all day, every day. It's challenging, it's draining, and you're like, oh, can I just get someone who's like just has Hashimoto's and just be done with it? It's easy.
You're like the only doctor out there who calls Hashimoto's easy, but
Yeah,
I
it's more
so
routine.
that's maybe something we have to do another episode on because that
Sure.
is another source of great suffering in this country and world. So just before we wrap up, kids who come in on medications, can 100% of them get off? I mean, in your experience, 100% of them get off their medications?
Yep.
Yeah, that's amazing. That right there is totally extraordinary. So where can people get a hold of you, Dr. Bourne, if they want
Just
to learn more about what you're doing?
right. You could Google my name, I'll come up. My website is bornintegrativeMedicine.com, and there's a learning center there, so there's more videos when Dr. Kumar and I are done. Eventually that will go up on the site, and that way there's information for people to know. But yeah, you Google my name or go to bornintegrativeMedicine.com. That's the easiest best way to find me. And then you can email me through the contact form, and that's just the way to do it, essentially.
Okay. And you can see patients remotely anywhere in the country or the world?
Yep. The 70% of my
Okay.
practice is all over the US and 30% is international. The international
Okay.
patients, I think you and I talked on the phone about this, and I thought the American healthcare system was pretty broken and kind of eye-opening to see these patients around the world. Their healthcare systems are just as broken, but in different ways. So I
Yeah.
have patients in Western Europe, Eastern Europe, the UK, Australia, New Zealand, a lot of the same problems. Just like one of our problems, right, is we have to pre-health, pre-authorization, everything. Plus, everything is crazy expensive. Some of these socialized medical systems are like, I can't even get in to see my GP for like 6 months,
Yeah.
or I need an ultrasound and, it's a 9-month wait. But the advantage of these places is cost because
Yeah.
they can go to a private pay hospital and get like an ultra the cost is nothing versus like,
Yeah.
us trying to send someone because it's so insurance driven to pay cash pay. You're like, "Oh, man, I can't afford that." No, well, now we have to pre-auth or that got rejected or
Yeah.
denied. So there's so many ways these things are so broken, but it made me
Yeah.
feel a little better about the United States healthcare system that we're not the only ones.
Yeah, we definitely have expediency here as far as healthcare goes. But yeah, the cost of an MRI is, $3, $4,000. When I was living in India, an MRI was $25.
Crazy.
$25. And
Yeah,
you,
it's
you
crazy.
had a full MRI with a radiologist read. So yeah, we got problems. Other people have problems. And I'm glad to see that everyone has access to you. So we'll
Yeah.
put the link to your website in the show notes. And I am super appreciative of you coming on the show. This has been very eye-opening for me. And I think your approach is super creative and super open-minded. And I think that people need to keep in mind when they're thinking about stuff like this that, hey, if it works, go with it. Doesn't
Yeah.
matter what the mechanism is. If it works and it's low risk, take it.
Right.
Because I
Exactly.
can tell you why my surgery works, if I cut your spine or your head, but there's real risks there. And if there's an alternative, to whatever problem you're having that has low risk and it works, why not? That's what
Right.
I would want for me, and that's what I want for all
Yeah.
my patients too.
Right. Yeah. No, I appreciate you having me on.
Yeah, it was great. Thanks a lot, man.
Yeah. Thank you.
All right, bye, Dr. Bourne.
Bye. See ya.
Okay, so I hope you enjoyed my conversation with Dr. Todd Born. I thought it was a fantastic conversation, and here's what I want you to walk away with. There are real, evidence supported alternatives to stimulant medications for ADHD, especially in kids. And the standard of care from the American Academy of Pediatrics actually tells us to try alternatives first. So, the first and easiest thing you can do is cut artificial dyes, colors, preservatives, and additives out of your kid's food altogether. Next, make sure your kid is getting 10 to 12 hours of sleep. You need to protect their sleep hygiene like it's your job. And then make sure you let your kids run, play, climb, and explore the way humans were designed to before we started sitting kids in chairs for 8 hours a day. In addition to those high impact lifestyle changes, supplements like a quality multivitamin, omega 3 fatty acids, a clean probiotic, magnesium, and some basic labs can definitely help. And for parents and adults who want to explore constitutional homeopathy, which despite controversy is held up in head-to-head trials against methylphenidate, which is Ritalin, Dr. Bourne sees patients all over the country and internationally. His website is bornintegrativemedicine.com. I'll put the link in the show notes. Okay, folks, that's the show. Cheers, and I'll see you next week.